So as I said, my name is Dora Corey. I am the Grants Research Specialist in the Office of Substance Use and Recovery Services and the Behavioral Health Bureau at CDPH. So welcome to our bidders conference for the Narcotics Arrest Diversion Program. If you have questions as we go along, please submit them in the chat and we'll have time to go over them at the end. And responses to all questions will be attached to the RFP that's posted in the e-procurement and iSupplier system. And as a reminder, make sure that you are registered through iSupplier in order to actually submit your application for the bid. And the deadline for questions that you can ask us is April 11th at noon. And again, as I said, this session is going to be recorded. And this presentation is a summary of the RFP, so if there are any discrepancies, please always follow what is posted exactly in the RFP for a full listing of all requirements and expectations. Some important dates. So the RFP was released on March 27th. Today is the bidders conference right now at noon. The deadline for questions is, sorry, there was a mistake and I will fix that before we post the slides. It's at 5 p.m. on the 11th. And all responses are due by April 25th at noon. For this specific program, the anticipated contract start date is going to be September 1st, 2025. That is in line with the grant from which this is funded. And I'll go into more details on that later. And the contractual year ends for this program on August 31st, 2026. So for this program, we have up to 2 contract extensions, each to not exceed 1 year. This is again at the discretion of the city based on the availability of funds, the need to extend services, and respondents' performance. So for the Narcotics Arrest Diversion Program, this RFP seeks to sustain the expansion of the program across the city of Chicago. NADP is the largest arrest diversion program of its kind in the country, and we divert individuals experiencing a substance use disorder before being formally charged with the crime. Overall, the overarching goals for this program are to divert persons arrested for possessing small amounts of an illicit substance, to improve public safety and reduce recidivism, to link diverted persons to low barrier trauma-informed harm reduction and treatment services for people with substance use disorder. And in line with all of our programming in the Office of Substance Use, to reduce the number of fatal and non-fatal opioid-related overdoses in Chicago. So an overview of the program, historically, NADP was conceptualized by the Chicago High Intensity Drug Trafficking Area or HIDTA, and born out of a partnership between the Chicago Police Department, the University of Chicago Crime Lab, and CDPH. Overall, because it's an arrest diversion program, the program is primarily administered by CPD. And in 2018, NADP was piloted in CPD District 11 on the west side, which serves Humboldt Park and East and West Garfield Park. These 3 community areas, along with Austin and North Lawndale, comprise our most impacted communities by the opioid epidemic in Chicago. And pretty regularly, year in, year out, they accommodate for about 1/3 of all opioid-related overdose EMS responses in the city. In 2021, November 29, 2021, NADP expanded to all police districts, so it is a citywide program. And originally, the eligibility criteria for the program were quite stringent. And it included a maximum possession of 1 gram or less of heroin or cocaine and no prior felony convictions for the individual that was apprehended. In 2022, eligibility criteria expanded to divert individuals arrested in Chicago for possession of 2 grams or less of an illicit substance as defined by the Illinois Controlled Substance Act. And past felony convictions are disqualifying only if they occurred within the last 10 years, and it's for all felony convictions for violent crime. An overview of what the diversion process looks like, and this is kind of the summary of how the services are provided currently is once an individual is arrested, they are taken to the police department, the district station. An officer will check through their database to determine eligibility for the individual. And if the individual is found eligible for and is consenting to the diversion, they are then escorted to a substance use counselor's room within the police department station. And then the individual is screened by that professional and is offered substance use treatment. The individual then would be released without charge and leaves the station. And what sets this program apart from others is that with our program here, NADP, that is where the individual's involvement with CPD ends. So if they are found eligible for diversion, whether or not they choose to accept treatment, they are released. And the individual receives further services and substance use treatment, whatever is determined by that counselor and whoever did the intake exam for them. And due to certain changes in the according to the Safety Act, the applicant must be able to respond within 4 hours of an arrest. So as I said earlier, opioid-related overdoses are primarily disproportionately impacted on West Side community areas, but we can see throughout this map here that every community area in Chicago is has experienced an opioid-related overdose EMS response over the last 5 years. So 2020, 2021, 2022, 2023, 2024, we see both fatal and non-fatal opioid EMS responses citywide. As I said earlier, 1/3 of all opioid-related overdose EMS responses occur in 5 West Side community areas, so Austin, East Garfield Park, Humboldt Park, North Lawndale, and West Garfield Park. And this map here is directly taken from the RFP, so you can see it there. We've overlaid census tracts across the city and with district police stations. So the map here shows opioid-related overdose EMS responses by census tract, and we can see corresponding police districts. So disproportionately on the west side, we see a high volume of opioid-related EMS responses, but there are also some pockets on the south side and in the loop as well. Just an overview of how the program has been run so far. Some current data is that participant demographics comprise about 78% male participants, 57% are Black, 25% are Hispanic, 66% of participants have been unemployed, and 12% are unhoused. Between 2021 and 2025, 2,700 individuals have been offered diversion. In 2024 alone, over 1,000 individuals were offered diversion. 1,000 clients received substance use disorder services. 854 clients were referred to harm reduction, substance use, and community support services. And the exciting thing is that 239 of those individuals that were diverted had never previously engaged in substance use treatment before. We've seen a great impact in this program. There is huge potential to reduce recidivism. So on average, individuals who are eligible for diversion are about 17% less likely to be rearrested for drug-related charges compared with those who are ineligible. And because not everyone who's eligible is diverted, estimates show right now that about that those individuals that are actually diverted are 72% less likely to be rearrested in the future. So overall, we see as of right now, NADP is reaching 3 goals at once. We connect individuals with substance use disorders to treatment. We reduce the time that criminal justice agencies spend on processing low-level drug offenses, and we improve public safety without incurring the harms of incarceration. So moving on to the scope of services, this is a proposed work plan for what the treatment provider would be required to do. So treatment provider clinicians will be located in high volume police district stations. Services at minimum must span 8 hours daily, although more hours might be required to meet the level of need. Referrals will be made by the police according to the most recent Chicago Police Department NADP program order. Patients can also walk in to receive treatment and substance use supports. Candidates that are eligible for deflection will meet face-to-face with a substance use treatment counselor. And diversion to the substance use treatment decisions will be based on substance use diagnosis and ASAM, which is the American Society for Addiction Medicine, level of care and multidimensional assessments, the candidate's treatment and recovery pathway preferences, and the accessible treatment options with prioritization of evidence-based treatment modalities, including medications for opioid use disorder, or MOUD. The substance use treatment clinician will then arrange for the diverted individual to be transported to a substance use provider or treatment facility. And every candidate referred to substance use treatment will be provided with opioid overdose education and resources for accessing naloxone, as well as test kits for fentanyl, xylazine, nitazines, and any other substances as needed, and the treatment provider program phone number and address so that they can call or return to the walk-in component of the program at any time. Diverted individuals will, in addition to receiving a warm handoff, so a transfer of care process that the candidate is involved in, to the substance use treatment provider or treatment facility. Following the initial deflection to substance use treatment, a case manager or recovery coach will make follow-up phone calls to each candidate to assess their need for additional substance use treatment and recovery supports and provide practical assistance to secure follow-up services when needed. Enhanced engagement or fieldwork door knocks might be required to support continued engagement. And the treatment provider will continue involvement with CPD, CDPH, and the designated technical assistance and evaluation partners to monitor the program impact and need for revisions to best meet the opioid-related overdose needs. As with all of our programs, all CDPH investments are guided by the following principles. CDPH delegates and their subcontractors are expected to integrate these principles into organizational policy and practice. So trauma-informed prevention and trauma-informed services, which is ensuring that services address trauma and healing. So questions to think about here as you're responding is, how does your organization ensure that the use of language such as pronouns, etc., do not offend or cause harm? How are programs and services structured to create physical and psychological safety? Cultural responsiveness, which is ensuring that services are culturally and linguistically appropriate. Does your organization acknowledge biases, stereotypes, and ensure respect for different backgrounds and cultures? How does your organization integrate individuals with shared experiences into the organization? And as always, health equity in all communities. So allocating resources and services to people and areas with the greatest need. How is data on the most impacted places and populations used to guide the allocation of resources and services to people in areas with the greatest need? So all applicants must provide a description of how their agency and proposed program aligns with each of these principles. Going over again, for the available funding, a total of $750,000 will be available through this RFP for the initial contract period beginning September 1st, 2025 through August 31st, 2026, with up to 2 extensions, each not to exceed 1 year, at the discretion of the city based on the availability of funds, the need to extend services, and the respondent's performance. So for this program, we anticipate awarding between 1 and 3 contracts through this RFP for up to $750,000, depending on the geographic reach of the proposed services. CDPH may reallocate funding across selected respondents during contract extension negotiations based on funding, each respondent's performance, and programmatic priorities. This program is funded through a cooperative agreement from CDC called Overdose Data to Action, limiting overdose through collaborative actions in localities, or OD2A local. On data and reporting, successful applicants will also be expected to submit de-identified monthly reports to CDPH detailing the number of individuals diverted, the services provided, and the number of patients connected to care and number of patients connected specifically to medications for opioid use disorder under this award. CDPH will provide a uniform data template for this reporting requirement. Data fields may include information such as demographic information, medical conditions, substance use history, substance use treatment history, substance use treatment follow-up, mental health conditions, employment history, and deflection to treatment referrals. Agencies will also be expected to work in partnership with CDPH to coordinate with relevant city entities, agencies, and departments to support seamless continuity of care for persons who require systems coordination. Data will also be used by community outreach and treatment provider to determine which police districts need training on NADP, which will be delivered by their outreach navigators. For program evaluation, respondents to this funding opportunity are expected to describe their program evaluation methodology to ensure the effectiveness of the proposed program, including metrics for successful implementation. Evaluation metrics and data management procedures should, at a minimum, describe the following components: how the applicant will measure and report on the proposed performance measures and deliverables, how client level and program performance data will be collected, maintained, analyzed, and incorporated into ongoing quality improvement activities, details on applicant policies and procedures on data privacy and security, applicant capacity, such as staff, data systems, policies, and procedures for performing data collection, program monitoring, evaluation, and quality improvement, and how the applicant will use performance measurement data for continuous quality improvement. For staffing, we require for this program that this funding be used for substance use counselors to provide evidence-based interventions and treatment and assist individuals in achieving their recovery and rehabilitative goals. CDPH recommends that people with lived experience, whether working as a certified peer recovery specialist or not, participate in the programs. We recognize that peers offer guidance, harm reduction education, and referrals to treatment or support services. As with all of our programs, all staff funded under this award must be compensated at a minimum of $20 per hour. This must be reflected in the proposed budgets. Applicants must describe how many staff, part-time, full-time, or hourly, will be funded under this award, and the role and time allocation of all positions must be described. If one or more agencies will serve as a subcontractor to the applicant, be specific in outlining staffing plans for each subcontractor. For eligibility requirements, there are multiple that are delineated in the RFP, but for us specifically, the ideal applicant will meet the following criteria. The applicant will have a demonstrated history of providing services to participants regardless of an individual's ability to pay, health insurance status, or immigration status, a demonstrated history of providing services that are responsive to the unique needs of communities of high need. This includes delivering services that are culturally, contextually, and linguistically responsive to the unique needs of people who use drugs and people at high risk of experiencing an overdose. A commitment to deliver services that recognize the impact that trauma has on individuals, communities, and across generations. A commitment to delivering services that are evidence-based or evidence-informed. This can be demonstrated both through proposing the use of interventions that have been demonstrated to be effective in generating the outcomes that the agency proposes in their application. The ideal applicant will also have a commitment to centering the lives and experiences of people with lived experience of substance use disorder, or overdose in program design, leadership, and implementation, and will have a demonstrated history of working with people who use drugs in Chicago through low barrier, non-judgmental, non-coercive programs and interventions. So this is a breakdown of the evaluation rubric. So for the staffing plan, up to 16 points are available. 8 points are available for the budget and justification. Demonstrating physical capacity will be up to 5 points. We have 14 available points on evaluation, data and quality improvement. 10 points will be allocated for the CPD district coverage plan. 6 points for the alignment with CDPH guiding principles. 20 points for experience and capacity, and 21 points for the project description, with a total of 100 points in the RFP. So now that is all of our presentation, so we can open it up for any questions that you may have. Feel free to come off mute or enter them into the chat.
Hi, good afternoon. This is Barthy calling from Prime Care Health. So just to clarify, the staffing plan would include having a staff person in the District 11 CPD.
It could be District 11, it could be another any other district, but we see that District 11 does see the most clients.
Yeah, I think District 11 would be highly recommended.
Yeah.
Yeah.
That makes sense. Okay. And then in terms of kind of, I mean, we're an FQHC, so in terms of treatment options, like is the expectation that, this behavioral health provider not only be able to, of course, refer to our own MAR services, but also be able to provide transportation to, detox or higher level of care?
Yes, I believe so. We will prefer if you can provide a treatment in-house, but if you have to do referrals, refer patients, that you help support them in getting transportation.
Okay, thank you.
Yeah.
Hi, I just wanted some clarification about being embedded in the districts. If we're covering several police districts, so we don't have to have staff embedded in each station. We just need to be able to respond within 4 hours of the arrest, correct?
Yes.
Oh. Thank you.
Yeah, of course. We did have a question in the chat. So can this information concerning NADP be shared with any other entity outside of this group? The slides will be shared after the presentation. And there is information existing about the program through the University of Chicago Crime Lab.
Harold, if the question is about whether this RFP opportunity can be shared, the answer is absolutely.
Yeah.
If it's other stuff, data, etc., then yes as well. But please encourage others who may not have made this bidders conference to be aware of this RFP.
Okay, thank you.
I have another question about the individuals that may be arrested. Is there, because they come in all ages. So are we going to be dealing with individuals under 18, perhaps?
So with this program, NADP is specifically for individuals who are 18 and over who are arrested for possession. It's not a youth diversion program.
Okay, thank you.
Mm-hmm. And if there are more questions about specific delivery from the CPD end, it's available in there in the CPD order that outlines this program, and it's linked in the footnotes in the RFP as well. They design the model so you can have more information on eligibility criteria and a breakdown of certain substances that a person might be apprehended with as well.
Okay.
Any other questions that we may have? Okay, if there are no more questions, we can wrap up. Thank you all for joining today, and for your interest in sustaining this program that we have here at CDPH. Again, as a reminder of upcoming deadlines, the deadline to respond to any questions that you may have is on the 11th. So you have until April 11th at 5 p.m. to ask questions. All responses to the RFP are due to CDPH by the 25th at noon. And then we will have a review period, and then hopefully the anticipated contract start date will be September 1st. So if there are no final questions, thank you all again for coming today, and for your interest in NADP.
Thank you.
Thank you.